office bearers of AIOS, Dr. Shalini and Dr. Shweta, for making me a part of this debate. I am so sorry that I am not able to attend this marvelous DreamCon 2022 because I have recently turned COVID positive. I'll be talking in favor of treatment of ocular hypertensives. Ocular hypertensives are a group of patients who have higher IOP, but discs and fields are absolutely normal. Now, what we know from the past, that is the OHTS. It was the largest randomized clinical trial to establish the efficacy and safety of ocular hypertensive treatment in prevention of onset of open-angle glaucoma in ocular hypertensives. So the study was designed with a screening of more than 3,000 patients, with nearly 800 patients in the observation arm and 800 patients in the medication arm. And the patients who were treated at all point in time, they have lower IOPs as compared to the ones who were observed without treatment. Now, what do we learn from OHTS? At 5 years follow-up, the cumulative probability of developing open-angle glaucoma in ocular hypertensives is nearly half in the treated group as compared to untreated group. We also know that the African Americans are genetically more predisposed to glaucoma. So if we remove that subset of African Americans, the cumulative probability of developing glaucoma is nearly 1/3 that of the people in the untreated group. So this treatment may be of greater benefit, especially in the Indian scenario. Also, we should look at the fact that only the visual fields and optic disc was used in the OHTS, as there was non-availability of RNFL and GCC analysis. Now, this is a case of 47-year-old male with high IOPs, 0.8:1 large cup, high myopia, open angles, and nearly normal pachymetries. And these are the visual fields. So at the one look of these visual fields, we feel that the patient should not be treated. But this is the disc which is showing you a 0.8:1 cupping with a diffuse nerve fiber layer loss. And this is the Heidelberg and the OCT of the patient showing you diffuse nerve fiber layer thinning in both the eyes. Now we'll look at some deeper facts. There are risk factors like myopia, age above the 40s, strong family history, and higher IOP. We'll look at his father's history. The father also has a large cupping with thinning of NRR, and again, he has no focal defects but diffused nerve fiber layer damage in both the eyes. And these are the visual fields and OCT of the patient, father of the patient, where we can see that the left eye is pretty significantly damaged. So observation is not a good idea. So this patient was put on treatment and the patient is controlled on treatment. So points to ponder here is OHT is a definite clinical entity. Treatment options should be seriously considered, especially in settings of family history, age, myopia, and Indian scenario in terms of irregular follow-up.